Welcome to the Therapy Dog Evaluation Orientation video. This video will demonstrate what to expect when you and your dog are evaluated to be a St. John Ambulance Therapy Dog team. Test number 1, meeting the evaluator. The evaluator will greet the handler first and ask permission to pet the dog. The evaluator will then pet the dog, check his feet, pet his head, check his ears, and run her fingers through the dog's coat. Test number 2, walking the dog. The handler will be instructed to walk the dog in an L pattern. The evaluator will have the team halt at various points in the pattern. When in a halt, the dog does not have to sit, but should stay reasonably close to the handler. The team should have a loose leash throughout the exercise. Test number 3, praise and interaction. Handlers are encouraged to bring the dog's favorite toy to this part of the evaluation. The handler will get the dog excited for approximately 10 seconds while holding on to the leash, and upon instruction from the evaluator, will tell the dog to stop play. The handler may use more than one command, but must demonstrate that the dog's excitement level is brought down in a reasonable amount of time. Test number 4, milling crowd with props. A minimum of 5 people will move in a random pattern to symbolize a busy senior home. Speaking loudly and using mobility aids such as walkers, crutches, and canes. The handler and dog will walk through the crowd 3 or more times, taking care to not cut anyone off. Test number 5, advancing crowd. The handler and the dog will stand in the middle of a circle of volunteers. Upon command, the volunteers will advance toward the dog with their arms outstretched and fists closed. The volunteers will move in a friendly, non-threatening manner. All dogs should remain on the ground for this exercise. The handler may choose to kneel close to the dog to relax the dog throughout the exercise. As always, the handler may keep a hand on the dog's collar for greater control. Test number 6, stationary crowd scene. Volunteers will form a circle within the test setting with mobility aids such as canes, crutches, and walkers. The handler will walk around the inside of the circle twice with the dog, introducing the dog to everyone. Be aware the petting can be a little harder than the dog is used to, so we can simulate what may happen in a visitation setting. The volunteers may also be instructed to do things such as shake when approaching the dog, speak with fluctuations in volume or tone, or unexpectedly hug your dog. The volunteers may also be instructed not to pet the dog or to be frightened when the team approaches. Small dogs under 10 pounds may be carried by the handler for one round, so that volunteers attempting to pet the dog can have easier access. The evaluators are looking for a comfortable response from your dog without excessive lip licking or tail between their legs. The handlers are encouraged to talk to their dog. Test number 7, comatose evaluator in wheelchair. While going around the circle, a volunteer in a robe and hat seated in a wheelchair is instructed to join the circle and remain motionless for a period of time. The handler and dog will advance to the robed person approximately 2 feet away. The dog may either sit or stand. The person in the robe remains motionless and staring at the ground. The dog is observed for 10 seconds for reactions. At this point, the evaluator may ask the team to reapproach the person in the wheelchair. When instructed to do so, the robed volunteer will move slowly and extend his or her hand out to the dog. Test number 8, combined evaluator in wheelchair with distractions. The evaluator in a wheelchair approaches the sitting dog from behind and circles around the dog and the handler. The behavior of the dog is observed. The evaluator will then ask the handler if they can treat the dog. The handler cannot refuse. The dog may either take the treat gently or refuse the treat altogether. Please note, the evaluator will hold the treat firmly for a few seconds after the dog takes it before allowing the dog to have it. Immediately following the treat, an assistant will run or walk quickly across the room. Immediately following this, a person standing a minimum of 6 feet behind the dog will cause a loud metallic distraction, usually a bag of empty cans or steel bowls. The dog is allowed to be startled. The evaluator is looking for the dog's recovery from the noises. For smaller dogs under 10 pounds, the evaluator may ask the dog to sit in his or her lap as demonstrated. Test number 9. Handler meeting handler, or dog meet dog. 2 teams are tested at the same time. Dogs need to be on the left side of their handler. The handler will advance to each other and shake hands to simulate meeting someone else in a hallway. It is the handler's responsibility to ensure their dog sits or stays before they shake hands. The dogs should not be stretching to see each other, barking, or jumping up. To schedule an evaluation for you and your dog, please contact the Provincial Office of St. John Ambulance at 1-888-273-0003 or email at cs.coordinator@sk.sja.ca.